In this video, we're going to be talking about pulmonary emboli, how it's treated, and when do you need a procedure called a thrombectomy. That's when we go in and remove those clots. Pulmonary emboli is a life-threatening condition, and it happens when blood clots, usually from the legs, travel through the veins, through your heart, and end up landing in the pulmonary arteries. Our heart has a right ventricle and a left ventricle. So the left ventricle is the bigger one because it has to pump the blood to all your organs, your arms, your legs, and then the blood comes back to the right atrium and goes to the right ventricle. The right ventricle is smaller because it's pumping blood only through the lungs. But the truth is, it's the same amount of blood that goes to all your organs and extremities that will come back to the heart, and the same amount of blood has to go through the lungs. So when a large amount of clot goes from the legs and blocks the circulation in the pulmonary arteries, essentially it's blocking the circulation of blood through your entire body. It's limiting it. The right ventricle, which had an easy job of just pumping blood through the lungs, now has all that clot to pump blood to, so it's like trying to breathe through a straw. It's very difficult. And sometimes if you occlude the whole circulation, you just, basically there is no blood return to the left heart and no blood will go to your brain, and that's how people die from a pulmonary emboli. Usually presents with a shortness of breath, which can be sudden, but sometimes it can get worse over a period of several days or even a couple of weeks that people may have a hard time noticing. Patients also can have chest pain, although this is not as common. And if the clot is really large, sometimes people may just collapse, and sometimes they could even die before they reach the hospital. Now, it's important to know the risk factors for pulmonary emboli, which include prolonged immobility, like having recent surgery or a long plane flight. Hormones can also be a cause, like birth control pills or even testosterone replacement. Patients with cancer are certainly at very high risk. Or patients with family history of blood clots, or people that know that they have a known clotting disorder like factor V of Leiden or protein C or S deficiencies. Nowadays, pulmonary emboli can be diagnosed very easily with a CT scan of the chest, but you do need contrast for that. And once patients are diagnosed, they usually are started immediately on blood thinners, which can be life-saving. And how long are you treated with blood thinners for pulmonary emboli? Usually the answer is at minimum 6 months. But it will depend on what was the cause of a pulmonary emboli and if you have predisposing factors. Usually, if somebody had a recent surgery or a long plane ride or is on hormone replacement, which are known causes for pulmonary emboli, we don't worry as much and just treat the cause. But patients that have a PE for no good reason, and if we can't find out why, sometimes we recommend that people will stay on the blood thinners for life. Thrombectomy is a procedure that became much simpler in the last few years, and it's essentially a fairly easy and quick procedure that takes probably 30 to 40 minutes to do, thanks to the new devices and catheters that are available today. Essentially, during this procedure, we insert a catheter through the groin. We then carefully navigate all the way to the pulmonary arteries. We inject some dye to see where the clots are. And then this catheter has the ability to aspirate and effectively remove all those blood clots. We usually recommend thrombectomy for patients that have a large blood clot, usually causing hemodynamic problems, meaning that the heart is having trouble beating against the lungs. And usually the way you know is by looking at the CT scan. You can notice that the right ventricle, which, like I said, is usually small, it dilates, meaning that's having a hard time. Sometimes we do an echocardiogram that can show the motion of the heart, and it's very accurate in showing that. Another advantage of removing these blood clots is, in a small amount of cases that you don't do that, those clots may persist long-term, causing long-term problems in the pulmonary arteries and the heart. And that is called chronic thromboembolic pulmonary hypertension. Pulmonary emboli can be a life-threatening condition and is dangerous. So if you develop unexplained shortness of breath or new chest pain, you definitely need to see a doctor or go to the ER or urgent care. But the good news is there are very effective treatments for that these days. And if you make it to a hospital, I almost guarantee you're not going to die from it. This is Minimally Invasive Insights, and I'm Dr. Fabio Komlos.